What is Enterovirus D68?
Well, enterovirus itself is a common virus that we deal with all throughout the year. The most common months are summer months and fall months. Enterovirus D68 is the specific strain that we're dealing with this year. D68 is not a new strain. We've dealt with it in the past. This year it's just particularly difficult to deal with.
What are the symptoms?
Enterovirus itself can cause a broad range of symptoms, from mild to severe. The mild symptoms are just like a typical common cold, cough, runny nose, fever, sneezing. The more severe symptoms are like wheezing, respiratory distress, shortness of breath, and things like that.
How is the virus spread?
This virus is spread just like most common colds, by secretions, coughing, sneezing, touching surfaces that have been contaminated.
Who is at risk?
With this virus, everyone is at risk, but there are some people that are more at risk. Infants, children, teenagers are at risk, mostly because they've not been exposed in the past and they haven't built the immunity to it. Children that are at the greatest risk are those children that have a history of asthma or respiratory symptoms. Adults, we can get the virus. We just typically have milder symptoms when we get it.
How is it diagnosed?
It's diagnosed with a simple lab test. We can diagnose enterovirus from nasal secretions or from throat secretions. The specific test for enterovirus D68 has to be sent off. So it's easy to diagnose enterovirus. It's not so easy to diagnose this specific strain of enterovirus. But as far as who needs to be tested for this, we need to test those patients with those severe respiratory symptoms. So, as far as going to your doctor's office or going to the emergency room for just the minor cough, cold, congestion, fever, it's not a test that should be done on a regular basis. And if you're having those symptoms, you should primarily come to your doctor first instead of just running to the emergency room.
What are the treatments for this virus?
For this virus, just like any other virus, there's no specific treatment. Most of it is just symptomatic care, making sure that nasal secretions are maintained, using albuterol as needed for wheezing. Like I said, it's just usually supportive care. The antibiotics will not help with this disease because it is a virus. And sometimes in the worst case scenarios, it's a hospitalization for that supportive care.
How can I protect myself and my children?
The most important part of protection is good hand hygiene. Hand washing regular times through the day with warm to hot water, up to 20 seconds at a time with a good antibacterial soap. That's the best that we can do. Obviously for coughing and sneezing, instead of coughing and sneezing into our hands, we need to do it into our arm. Surfaces that are regularly touched, phones, doorknobs, things such as that should be disinfected regularly. If you're sick yourself, you need to stay home. If you know someone's sick, you should avoid contact with that person, and if applicable, should get your flu vaccine.